Hi, my name is Gloria Robert. Today, we are looking at the topic reproductive health. Objectives of lesson. During the course of the lesson, the learners should be able to 1. Define conception. 2. Define prenatal care. 3. Mention at least 3 effects of STIs and AIDS on fetus. 4. State 4 risks involved during child delivery. 5. Define breastfeeding, infant mortality, and birth defect. And 6. Give at least 2 importance of genetic counseling. Now in our video on reproductive health 1, we looked at the meaning of reproductive health. We discussed female genital mutilation, its effects, types, and so on. But in this video, reproductive health 2, we are going to be looking at the concepts such as conception. We'll talk about child delivery and the risks involved. We'll discuss breastfeeding and its importance, and so on. So what is conception? Conception occurs when the male sex gamete fuses with the female sex gamete to form a zygote in a sexually matured female. This process is called fertilization, and it takes place in the oviduct or fallopian tube of the woman. Now such a female is said to be pregnant. Now here is an image that shows a female that is seriously or very pregnant. Okay. Now what is prenatal care? Prenatal care is also known as antenatal care. Prenatal care is the medical treatment and training given to a woman during pregnancy, labor and delivery by nurses, midwives and doctors in order to prevent complications in both the mother and baby. Now such complications include 1. Maternal death during pregnancy, that is the death of the mother. 2. Labor-related complications. 3. Excessive loss of blood by the mother. 4. Infant mortality, that is infant death and defect. And 5. Stillbirth, that is the death of the baby in the womb before delivery, and so on. Don't forget, prenatal care is commonly known as antenatal care. Effect of STIs, HIV/AIDS, and AIDS on fetus. Fetus is an unborn child. Most times, the issue of STIs, HIV, and AIDS are of great concern to pregnant women. STIs, HIV, and AIDS can be passed on to an unborn child from its mother if proper reproductive care is not given. Now, some of the effects of these are: it can lead to low birth weight in the baby, unborn child. It can lead to brain damage. It can lead to blindness. It can lead to infection in the baby's blood. It can lead to acute hepatitis, deafness, lack of coordination in body movement. It can cause stillbirth and of course chronic liver diseases. So let's look at risks involved during child delivery. Child delivery means giving birth. Now, delivery is the process of expelling or bringing forth the fetus from the uterus or womb of a woman. There are different delivery methods. The most common are the natural birth, also known as the vaginal birth, and cesarean delivery, which is commonly known as surgery. Now, many risks are related to the delivery process. Some of the risks are: 1. Premature labor. 2. Placenta-related problems. 3. Problems with the positioning of the baby. 4. Excessive bleeding, that is from the mother. 5. Baby's joint dislocation. 6. Abnormal heart rate of the baby. 7. Problems with the umbilical cord, and so on. So this is an image showing the different sections involved in child delivery. So take your time and go through. Importance of breastfeeding. What is breastfeeding? Breastfeeding is the art of feeding a baby or infant with milk from the breast by a nursing mother. Breastfeeding is an art that is very important because of the various benefits it provides the baby. The breast milk is very rich in nutrients, especially the one called colostrum, which is the first milk produced by a nursing mother after delivery and should be encouraged. Breastfeeding helps the baby to resist diseases. helps babies develop healthily and reduce infant death. Now here is an image showing a mother breastfeeding her baby. Causes of infant mortality. Infant mortality is the death of newborn babies. This can be due to 1. Lack of good hygiene by the mother. 2. Lack of nourishing nutrients. 3. Female genital mutilation issues. 4. Sexually transmitted diseases. And 5. Lack of prenatal care or antenatal care, etc. Now, birth defect. Any abnormalities in babies at birth, such as deafness, blindness, body deformity, brain damage, sex inherited problems, and so on, are called birth defects. What are the causes? Causes can be as a result of 1. Excessive intake of alcohol and drug abuse during pregnancy by the mother. It can be as a result of STIs and HIV and AIDS. It can be due to smoking by the mother. It can be due to exposure to harmful chemicals and hereditary problems. And that will take us to what we call genetic counseling. Now, what is genetic counseling? Genetic counseling is the process of advising individuals and families affected by or at risk of genetic disorder in order to help them understand, make decisions, and adapt to the genetic risks involved. A genetic counselor is a person that provides information and support to families affected by or at risk of a genetic disorder during counseling. Genetic counseling is important as it helps couples to 1. It helps them in decision making regarding genetic tests or family planning. 2. It helps them in carrying out tests most appropriate during pregnancy. 3. It helps them to adapt or cope to any genetic issues. And 4. It provides supportive counseling sections or services. Now here is an image showing a counselor and 2 couples having a counseling session with her. Oh, this is our students' activities, so it's time for you to answer these questions. Go through the question and I hope you'll be able to answer them all. But in case you have any challenge, go back to the video, watch it again, listen to it, and at the end I believe you'll be able to tackle all the questions here. At this moment I want to say, please subscribe to my channel, drop your comments, view and download my videos, click on the notification bell, and a very big thank you to you. Wow, finally answers to students' activities. So I'll be referring you back to the video. From the video you can get answers to all the questions. So I want to thank you for joining me in this class. Thanks for learning.